Pharmacogenetic testing, otherwise known as personalized medicine, will allow you to add precision to your prescribing by tailoring medical treatments to the individual patient using sophisticated molecular tools, which will give you better outcomes with fewer adverse events. Personalized medicine is a substantial shift from what works for the typical patient to what works for the individual patient. It will allow you to prescribe the right drug for the right patient at the right dose. So, what is pharmacogenetics? Your patient's genes affect how drugs are metabolized and the patient's response to drugs. That can be predicted in advance, which will allow you to practice better medicine. Genomic differences influence efficacy, particularly with drugs that have narrow therapeutic windows. Genomic differences result in an increase in risk of serious drug side effects and an increased risk in drug-to-drug interactions. So why would you, as a busy physician, want to incorporate pharmacogenetic testing into your daily practice? Pharmacogenetic testing will allow you to identify the likelihood of adverse drug events. 25 to 50% of your patients have a polymorphism, which affects the way that they metabolize drugs and could result in an adverse drug event. 2 to 3 billion ADEs occur annually, resulting in excess of 100,000 deaths in the United States alone. Pharmacogenetic testing will increase drug efficacy, increase patient compliance, and therefore patient retention. It's becoming the standard of care if it's not already. It was on the 2012 cardiology boards and will be on the upcoming anesthesiology boards. Fair to argue that once a methodology has hit the specialty boards, that it is standard of care. Pharmacogenetic testing will allow you to market your practice, mitigate risk, and reduce healthcare costs. Pharmacogenetic dynamics are already in play in your practice. A patient group with the same diagnosis, giving them the same prescription for that diagnosis, will result in 4 very distinct patient groups. Some patients will have no benefit and toxicity. Some patients will have no benefit without toxicity. With regard to these patients, do you reduce the dose? Do you try a different drug? Some patients will have no benefit and no toxicity, thereby wasting therapeutic time and therapeutic dollars. What do you do with these patients? Offer them a different drug? What drug? Based upon their metabolizer status, you can make that decision scientifically. And then you'll have the majority of your patients that will benefit and have no toxicity. And for that group of patients, a normal dose is okay. Pharmacogenetics will allow you to distinguish in advance, scientifically, using evidence-based medicine, which of this population falls into these 4 distinct patient groups. A patient's genetic profile will result in distinct metabolizer statuses. An abnormal metabolizer or an ultra-rapid metabolizer as compared to a normal metabolizer, as compared to an abnormal metabolizer with an intermediate status or an abnormal metabolizer with a poor status. So your normal metabolizers will be overshadowed by your abnormal ultra-rapid, your abnormal intermediate, and your abnormal poor. Knowing a patient's genetic profile will allow you to adjust patient drug therapy to improve efficacy and reduce the risk of adverse drug events. It's clear from all of the data that one size does not fit all when it comes to drug prescribing. This chart is a representation of the percentage of the population for which a particular drug is not effective. And you can see by these numbers that we can do better, and pharmacogenetic testing will allow you to know which category your patient falls in when prescribing an SSRI, for instance. Pharmacogenetic testing is quick and easy. It's done with a buccal swab, so it's simple, quick, and convenient. There's a no-cost test kit and on-site pickup. You will receive clinically actionable results that are easy to read and delivered electronically, color-coded for ease of interpretation. It's covered by Medicare and most major commercial insurance providers. The physician is reimbursed for the interpretation, and there is a Form D available for consultation. The reports are simple and informative, easy to read, and color-coded to alert when dose adjustments or alternative drugs should be considered. Color-coded with clinically actionable therapeutic recommendations. The lab offers cardiac and pain management panels. The cardiac panel addresses Plavix, beta blockers, Coumadin, and the risk factors including ApoE, factor 2, factor 5, and MTHFR. The pain management panel speaks to drugs in the following categories: codeine, hydrocodone, oxycodone, fentanyl, methadone, etc. The psychiatric medication covers drugs that address depression, bipolar disorder, antipsychotic drugs, and ADHD. And finally, the urology panel speaks to prostate drugs, overactive bladder drugs, and erectile dysfunction drugs. So who's doing pharmacogenetic testing and what are they saying? Harvard Medical School and Beth Israel Deaconess, Georgetown Medical School, Vanderbilt, Stanford, Scripps Howard, Columbia, Presbyterian, and Cornell, Duke, Chapel Hill, UPMC, the NIH, the FDA, and drug manufacturers themselves are processing what they refer to as tailored therapeutics, which will have different formulas of their drugs based upon metabolizer status. The future is here. Pharmacogenetic testing is becoming the standard of care. The president of Eli Lilly perhaps said it best when he said, "The power in tailored therapeutics is for us to say more clearly to payers, providers, and patients, this drug is not for everyone, but it is for you." That's exceedingly powerful. The day of the blockbuster drug is over. The NIH has said very clearly that one of its biggest goals is to cut the cost of sequencing the entire human genome to $1,000 or less. This advance will pave the way for each person's genome to be sequenced as part of the standard of care, leading to a revolution in the practice of medicine. You too, doctor, can incorporate this significant medical ancillary into your practice through AO Biotech and its cardiac panel, its pain management panel, its psychiatric drug panel, its urology panel, and soon to be its diabetic drug panel, its antibiotic panel, and more to come.